it happens with all of us. So that's when I think I became more open to talk about having any specific anxiety. And also I was recently clinically diagnosed with it, so I had a proper backing for me not to say I'm just having an anxious state. Okay, it's not just that. ADHD and anxiety. And I actually seeked it out only because I was actually finding it very hard. My body was heating up in social gatherings, and I was like physically responding to it. So I was also finding it very hard to focus on certain things, and my focus was going in and out. And then I realized that I gave myself a lot of credit for being an amazing multitasker. And then I realized that I can multitask, but it does take a toll on me. And I need to understand why it's taking a toll on me, because I'm forgetting the most random things, like things that I have scheduled. I'm forgetting. Why am I forgetting these things? So I did a test, professional test, not like some random personality test or something, over 3 days, and I was diagnosed with ADHD and anxiety, and immediately I was.
Hello, welcome. So we are studying about ADHD. You all must be thinking, what is Alia Bhatt doing here? So in a recent interview, she mentioned about her diagnosis ADHD. So today we are studying about ADHD. It is for educational purpose only. Okay. So ADHD stands for Attention Deficit and Hyperactivity Disorder. So what is it? So it is mainly a neuropsychiatric disorder. It presents with attention deficit, as the name suggests, which means there is inattention in the patient and the patient lost focus. The patient also present with hyperactivity and impulsivity. Also there can be patient with combined presentation, which is the most common presentation. In this, the patient has low attention span, lost focus or decreased focus, and patient has hyperactivity. The patient is not able to sit at one place or indulge in one activity. They keep on changing the things that they're doing. For example, if a student is studying, he or she keeps on changing the subject they're studying or the topic they're studying without completing the previous one. Or impulsivity means they tend to do things impulsively. So like for example, if they are on walk and they're outside and suddenly they get an impulse to check whether they have locked the door or not, and etc. There can be anything which directs you to do instant action comes under impulsivity. And if that becomes a problem, then it leads to diseases. Okay, so at one point of the time, every one of us think that we might have got some kind of anxiety, depression, or ADHD. So yeah, that happens. So important thing to keep in mind is that the patient with ADHD has normal intelligence. The patient may have some difficulties in the schooling, which is because of the loss of focus. The patient not able to complete the study schedule or whatever. So but the intelligence is normal, that is to be keep in mind. So for diagnosis, mostly it is diagnosed in children. For diagnosis in children, out of 9 symptoms, 6 symptoms should be present for at least 6 months. So the timing is very important in psychiatry as a subject. So also the symptoms should be started before 12 years of age. Also, diagnosis can be established only after 4 years of age, because under 4 years of age the child is still developing. He may recover or it may be a temporary phase. Okay, and the symptoms should be present in at least 2 settings: example, home, school, workshop or playground, etc. Symptoms should have negative impact on the social, academic, occupational functioning. Means the symptom have started affecting the academic. So we need to understand that whatever symptoms we're experiencing, there's almost a homeostasis. So there is a balance in our body. Okay, so if we are experiencing some symptoms which are minor but it doesn't affecting our everyday life, it doesn't come under the category of disorders, because sleek amount of disturbances happen in each and everyone's body. So the impact should be there to diagnose it. Okay, and the symptoms don't occur exclusively during the course of psychiatric illness. Means there should not be any other psychiatric illness associated with it. Example, any kind of depression, any kind of anxiety, any kind of trauma which they are currently in. So all those have to be ruled out. Also, the disease or the symptom should not be explained by another mental disorder, which we have discussed. So these are for the these guidelines are for children. For adults and adolescents above 17 years of age, even 5 symptoms out of 9 symptoms, if present, should be considered for diagnosis. Also, for diagnosis, we use nowadays scientists are using neuroimaging studies. So the functional neuroimaging study shows hypometabolism of the frontal lobes. So we now know that ADHD is due to hypometabolism of the frontal lobe. So maybe new kind of therapies are coming in the future. We know. Okay, and the it is also seen that if the child if the ADHD present in childhood, it can persist in adulthood. Means it doesn't happen that if it present in child, it doesn't carry on to the adulthood. Okay, so and also it is commonly associated with oppositional defined disorder. In this disorder, the child or the adolescent, maybe they oppose it, or they what we can say, they define, they do not listen to the person whom they are dependent on. So they are always, in attack mode or oppositional. They always fight with their dependent, maybe parents or like that. This is oppositional defiant disorder. Okay, the management of the ADHD includes stimulants. These are the first line of therapy. It includes methylphenidate, amphetamine, and behavior therapy can also be tried. And non-stimulants are used in some cases, like atomoxetine, alpha-2 agonists like clonidine, guanfacine. So this is about ADHD. So please don't take it as a burden, or it there should be awareness about this, and it should not be a taboo in the society, any mental illness. Okay, so that's it.